Welcome back, everybody, on this Tuesday. Joining us is Dr. Ed Rivera with CHI Health St. Elizabeth. We're talking hyperbaric oxygen therapy. If you suffer from a chronic wound, you may want to hear what the doctor has to say. Welcome.
Thank you.
Yeah, great to see you.
Having me.
Sure, anytime, anytime. So I'm going to tell you what, Doctor, I don't know anything about hyperbaric oxygen therapy. I never needed it. Hope I never have to. But anyway, wow, what's it all about? Sounds like it's pretty interesting.
It is, and it's really exciting. We're very, very happy to have this therapy at St. Elizabeth's here in Lincoln. And to be honest, the concepts and the logic is quite simple. We have many, many patients here in town and the outlying areas with chronic, very complex wounds, and one of the treatment modalities we have here is hyperbaric oxygen. And what that is basically is these patients, we bring them in, we put them in these specialized chambers. They almost look like escape pods that you might see.
Them up there right now.
Yeah,
is that it?
You might see in a sci-fi movie, but these patients are actually breathing very high levels of oxygen, essentially 100% concentrated. And what our bodies do, it's fantastic. After the exposure to such high levels of oxygen, we synthesize a special protein. It's called VEGF. It sort of sets off a cascade that allows us to actually grow new blood vessels. And as we know, more blood, more nutrients can get to these wounds that are very complex and helps them in the healing process.
Okay, so promotes the healing. What kind of candidates would be up for something like this? You talk about wound patients, but what kind of wounds? Diabetes, or what kind of radiation treatment?
Yeah, well, the indications are multiple, but we do treat various different kinds of wounds, different etiologies. For example, diabetic ulcers, diabetic wounds, chronic bone infections, complications from radiation, wounds due to aggressive skin and back and soft tissue.
So the list goes on, long list.
Oh, it's varied indications.
Are you? I don't know much about the insurance situation. Are you finding most policies are covering this, or is this sort of a specialty thing?
Exactly right. You will find that the treatment works. So insurance companies are willing to pay for this because obviously the costs of the alternative, which would be dressings, health home nurse visits, debridements in the operating room, there is a cost-saving benefit to treating these patients and healing their wounds.
Is there a percentage or a number you can put on it? Like, in other words, someone comes in with the same type of wound, they do the hyperbaric thing, or someone else does the old-fashioned way, for lack of a better term. Is there a number you can put on it in terms of how much faster the healing is?
Well, it's significant. You know, everyone's different. Hard for me to say exactly, but the alternative to traditional wound therapy, it really is significant, and you'll find quite a few patients who've had their wounds just sort of shrink up and vanish after our standard therapies. It's fantastic.
And it looks like nothing to worry about. You're sitting in that thing, and it's like you're just watching TV or something.
To be honest, it's almost as if you're on a first-class flight for a couple hours. You're in this chamber. The biggest discomfort patients will have would be the fullness they feel in their ears, for example, just like you're flying in an airplane.
Okay, but they don't serve any cocktails, I'm sure.
No, no meals included.
Yeah, that won't come, no. But no, that's very interesting. You want to learn more, contact CHI Health, and you can contact Dr. Ed Rivera, right?
Yeah,
okay.
That's right.
Very good. Thanks for coming in, Doctor. Stay warm out there, and we'll be right back in just a little bit.